Sounds good.
So kick us off, Casey.
Okay. Hello, everyone. My name is Casey Wilkinson. I'm a member in the executive committee of the DD Council. Welcome to the state plan listening session.
Correct, Mike.
The 2027-2031 um, state plan. Um, Feel free to review the full state plan at the following link and the QR code. Um, thank you for joining us. Please
You,
keep your microphone muted. If you have any questions or comments, please send them using the chat function. If you would like to speak, use the raise hand function under reactions at the bottom of your screen, and we will unmute you. You can access the closed captioning feature at the bottom of your screen. Our ASL interpreter will be pinned at the top of your screen. Thank you.
thanks, Casey. Hello, everybody. Welcome and thanks for coming here today, this evening, joining us, I guess, at nighttime. I'm Brooke Lovelace. I'm the Executive Director of the Iowa Developmental Disabilities Council, and I'm just going to walk through a little bit about how our plan was created, how we got here today, and then I'm going to turn it back over to Casey, that's going to walk us through our first goal. But first, about a year and a half ago, we formed a state plan committee, and they have met 6 times this past year and a half to provide input and to give a little bit of guidance on the planning process from start to finish. Then in both of our January and March of 2025 meetings, we had representatives from our state agencies that are on our council, which are vocational rehabilitation, the Department of Aging, Medicaid, the University Centers for Excellence in Developmental Disabilities, Disability Rights Iowa, and the program that represents the Title V programs. They during those 2 meetings provided input to the council on what they thought that from their agency's perspective we should work on for priorities. And then the spring of 2025, the council did send a survey out to our 9,000, more than 9,000 advocates and partners across the state to hear from them about what they thought the council should focus on. And we were pretty pleased with the response. We had over about 368 responses for that. We also held a community virtual conversation with advocates in May. Each of our council members also provided thoughtful input into the survey. We had them do. Oops, I just completely went back. We had each one of them do their own survey to keep their responses separate from the rest of our network that did the survey as well. And then our council then worked with planning experts, strategic planning experts, to help us review and organize the information that we collected. Then also our council members and staff did a planning retreat to review all the survey results, their thoughts, and decide what they thought was most important. And then our state plan executive summary was was developed then based on all their input that was gathered up until that point. Then our DD Council met in November and reviewed the staff reviewed the drafted goals and objectives during our November 2025 meeting. They suggested revisions and additions, and then a draft plan was then approved at the council's March 26th meeting. And so that's when once we had that approval, we were able to put it out for the public to provide some input to it, which is what we're doing now. So this is part of that process. And then our plan is due August 15th. So with that, Casey, I think I'm going to turn it back over to you to review our goal 1.
Thank you, Brooke. Our goal 1 is leadership and advocacy. By 2031, the council will increase opportunities for people with developmental disabilities and their families to improve their knowledge, skills, and active participation in advocacy efforts to drive positive change. Objective 1.1. Each year, we will support more Iowans with developmental disabilities in addition to a variety of other other disabilities and their family members to strengthen leadership and self-advocacy skills. Objective 1.2, support organizations and grassroots advocacy groups led by people who have disabilities and expand opportunities for people with developmental disabilities to lead, mentor, and strengthen their communities. Objective 1.3, provide
Sorry,
um,
Casey, keep talking.
provide opportunities for individuals with disabilities who are subject matter experts to be compensated for their collaboration and leadership on key projects that advance system change. Brooke will be reading goal 2. Is
Yep.
that correct?
Yep, that's correct, Casey. And if you're following along, if you did click on the link or scan that QR code on the first slide, you can see that we have some proposed activities under each one of those. So you can see actually what the action is, what we're actually going to do underneath each of those objectives. So yes, I'm going to lead us on to goal 2, which bear with us, guys. This one has quite a few objectives to it. But this is what we call our systems change goal. And so we want to empower communities through doing some systems change activities. So by 2031, self and family advocates will advocate to strengthen policies, practices, and disability community services to ensure people with developmental disabilities have the support they need to live healthy, thriving lives. So our first objective here is through our DD Council resources, our training, and events, people with developmental disabilities, their families, providers, advocates, and other stakeholders can strengthen their engagement with policymakers on issues and legislation that matters to them. Our second objective then is the council will actively engage and listen to people with developmental disabilities and their families to ensure the council can inform and educate policymakers each year on at least 3 key policy issues or proposals that align with the council's mission and the DD Act. Our third objective under here is that we will support youth with developmental disabilities as they transition to adulthood along with their families and provide the tools and supports they need to succeed and thrive. The fourth objective is the DD Council will collaborate annually as needed with partners across the DD network, our state agencies, to respond to natural and man-made disasters and public health issues that could affect people with developmental disabilities and their families. Our fifth objective under here is through training and policy change, technical assistance, and resources. The DD Council will support and collaborate with the DD network, our, again, state agencies, our community programs, and other organizations to increase employment opportunities for people with disabilities. Only 2 more to go, so bear with us. Our sixth objective is that by 2031, people with developmental disabilities and their families will expand their knowledge, tools, and confidence to advocate for quality, accessible healthcare and engage in healthy behaviors through training, some peer support, and learning opportunities. And then our final objective under this goal is that the DD Council will work each year with the DD Network partners and state agencies to protect disability rights, promote supportive decision-making, and strengthen policies and practices that support adults with disabilities and their families, including as people age. So those are our objectives and our 2 goals for our state plan. And as I mentioned earlier, if you were following along, you can see some of our action that we're doing under each of those. And so I think Casey now is going to walk us through some questions. Before we do that, Casey, I think there's some questions in the chat, but now I can't see them.
There is.
Let me stop sharing for just a second so we can see those questions.
So Madison was asking if we can go back to the first slide.
Okay, I think I can do that.
Thank you.
I did not get the memo to follow along.
I think it's
There's
the
our
slide of the QR code.
Yeah, there's our QR code and there's our link, Madison. So I'll give you a couple seconds to get that. And Casey, were there any other questions?
Um, let me see here. Um, so I don't see any questions in the chat.
Okay, then Madison, did you get that? Were you able to get that?
Hi, Madison. Were you able to click on the link? No, the were you able to access the link?
And Heidi, maybe you could go ahead if you wouldn't mind, Heidi, and pasting that link into the chat for folks as well too.
That
I
might
can do
be
that.
helpful.
Yeah.
So, all right, Casey, you want to go ahead and we should have mentioned this during the housekeeping. We are recording this so we can get people's comments, so we can share those with others that couldn't be here today, like our full council and our state plan committee. So Casey, I'll go ahead and let you lead this discussion.
Thank you, Brooke. So the first portion of the discussion is, does anyone have any questions or comments pertaining to goal one, leadership and advocacy?
I have a question. So it's pertaining to school districts and the AEA. What would that look like when in the future when a lot of our special ed teachers are deciding to keep the services or move on with their own services?
That is a good question. Brooke, would it be okay if we go back to the goal one, leadership and advocacy slide?
Well, we can definitely do that. Or Madison, you can follow along too. I would say that the work that we do with the school system would probably fall under goal two. But I'm not quite following what you said, what you meant by teachers keeping their services.
I meant like teachers keeping kids keeping their special ed services because I go to Valley and right now they're not even they want to transition their kids out from special ed services for their programs for IEP goals, and I don't think that's right
Okay.
because parents should have that choice. No one in the legislature should have that choice to keep them safe, plus keep their goals in mind.
Okay. Thanks, Madison, for that. And I think some of that work is what you would see under goal two for when we work with youth as they transition and making sure that the youth and their families have the right supports in place so they can do that. And then again with some of our advocacy work under that goal. But I appreciate that comment.
Something that comes to mind is maybe Melissa from the College of I mean the Department of Education might be able to answer that question, like maybe if it's okay to share the email of Melissa.
Sure, we can do that.
Okay.
She's on our council.
Yeah.
Yeah.
I'll go ahead and share in the chat Melissa's email. Does anybody have any other questions pertaining to goal 1? Feel free to raise your hand or to unmute
I see that there's a question
or
in the
to write
chat.
it in the chat too. Um,
Oh, I see. Thank you, Heidi, for sharing that. So the link is now in the chat.
okay. Thank you, Heidi.
Yeah, of
Um,
course.
I found the email. I will add the email in the chat. Melissa's email. Okay. Does everybody agree to go to questions pertaining to goal 2? Empowering communities through system change.
So any comments or questions on our goal 2 and our objectives that we just went through?
Yes. Does anybody have questions or comments for goal 2, empowering communities through system change and the objectives?
My name's Consuela. I know Casey. We have a son that's 22 years old, and we just had a last ISP meeting, and they told us that he is on a very long list of DAHAB, and that services are being cut, and they didn't give me a straight answer. He's with Systems Unlimited, but I want to find a way to what's going on is what I'm thinking. It's like these are built-in services for our children and for our adults and our loved ones. And why are we not providing them to our people? Because even his roommate in his house got his services cut because they're only able to support 4-on-1 care in a DAHAB. And I've created a really nice flow chart that I shared with Casey, and I have a lot of ideas, and I've just kind of been thinking and getting up there to like starting the engine up. So, and I want to express that concern because I know that there is funding. I know that this should be happening. I know that there was staff shortages, there was funding issues, but if we have valid organizations that are providing services and they're already set up for these services, what's the problem? Where is there a dislink? Because I'm frustrated as a parent.
I can hear that. Thank you for sharing that. So they're saying that there's a waiting list for your son to access those rehabilitation services.
Yes, and they say it's very long, and they have had cut their services, and they're really only taking folks that have 3-to-1 or 4-to-1 services
through DAHAB.
Through DAHAB.
And that's your provider that's stating that, not the who's authorizing.
Not my case manager. No. And I talked to her and I asked her what I need to do, and I came up with a plan. And Casey invited me here because she knows I'm a pretty good advocate. So
I'd love to see your plan. If you want to email that to me, I'm real curious what that looks like.
Great. Yeah, no. It's in an Excel sheet. If you want to share your email, or Casey can share it too.
Yeah, no, I can put that in the chat.
I have little comments in all my boxes of my flow sheet, and I kind of was sitting at a point where, is this my son problem, or is this a waiver community problem? And I know what it is.
It's a waiver community problem. Yeah, it's a systems problem right now with providers not having enough staff to take on people. So even like we're hearing people come off a waiting list, and then they come off the waiting list for a waiver, but they can't find any services to support them. So,
and I need to be out there shouting.
Yeah, I'd love to see your flow chart or your Excel spreadsheet.
Hey, Casey,
If
can you
you
share that?
want, if you want, I can forward it, Brooke.
Please,
If Consuela gives me permission to.
I
I
gave you
did put,
permission. Yes.
Sounds
Yes.
Consuela, I did put my email in the chat, so you
Okay.
can just send that directly to me.
Okay. But no, I find a lot of frustration. My son has been in a group home the first year. We've survived. So it's been tremendously fun. It it he's grown so much, but it's time for me to be like, no, these services are offered. I mean, it almost feels like COVID all over again, sadly. Um, but
Are
yeah.
you considering employment services at all for your son?
Yes, he actually just came off the waiting list, and we have
Okay.
a meeting on the 21st for him to start employment.
Great.
But when he was in high school, he had so many opportunities. He had a really amazing 4A teacher that gave him so many opportunities. He was working at 2 or 3 places, and when he graduated, we extended it out with a CCO employee that I managed, but and she helped out taking care of him, which was a really great program too. Just a lot for one person to handle. So,
Well, thank you for sharing that.
mhm,
And you're not
something
alone.
that
We do hear that from a lot of folks.
mhm.
something that comes to mind is that this would fall under the category of the transition from high school to after high school, like adulthood. Is
Yes.
that correct, Brooke?
Yeah, we do have an objective under goal 2 that is trying to get at that. Yes, definitely.
Yeah.
That would,
Um,
as a parent, that was another very hard thing to navigate. Um, it There were not many choices, and actually, even getting him placed in a group home, there were not many choices, and it was because we knew the right people. I mean, we knew someone that used to be on the Systems Unlimited board that had someone dig through our waiting list of him being there. So we've had a lot of really good things, and we have a really great case manager. So I mean, there's a lot of great things that are happening. It's going to take a village.
Yeah. Yep. Thank you.
Thank you, Consuela. Um, I can relate to what Consuela was saying because, for example, um, the waiting list for the waiver, for example, in my case, it's a few more years. So the waiting list, I think they told us it would be 2 to 5 years waiting list from from today because I was in the waiting list to get approved for a waiver, and then today I actually got the phone call. Then in a few years, I would get the services.
Did you want to go back to our case? Do you want me to bring back up the questions, Casey?
Yes. Consuela was mentioning in the chat that it took 10 years for her son to get the ID waiver.
It's unthinkable, really.
Does does anybody have any more questions pertaining to goal 2, empowering communities through systems change?
I have a question. So, I also relate to what Consuelo was saying. I am almost on the ID waiver, just it's gonna start in October, I believe. So, April called from the ID waiver, from ID called my mom and she said, I think we're almost we're almost there for Madison to be on the waiver. And and then my counselor, my job counselor, Jennifer, was talking about how it was important, how looked it up, and she said, I think you're almost on the waiver too. And she talked to me about benefits counseling with Social Security. If you haven't heard of that, it's another way of saying the money that that your child or that that your child earns is gonna go to specific resources for that.
What was your question, Madison? I'm not sure if that's exactly how that works there, but what was your question? I'm sorry, I missed that.
So my question is there a way to get more services with social work,
Well, I think when
with
you talk
social
about
worker
benefit,
case management?
while there are some really good benefit planners that are out there. Disability Rights Iowa comes to mind. They have a program on that, and that's usually who we go to if we have questions about how your disability benefits might be affected by working or anything like that. So I'd encourage you to contact them. There's also some other entities that have benefits planners too. I want to say Voc Rehab also offers that service as well.
I am
Um,
going to
Thank you.
contact them this weekend.
great, great.
Them this week. Contact DRI, Disability Rights Iowa, this weekend to ask them
Okay, they do have an
questions.
intake number. Yep, yep, that's who I would go to for that. So thanks for that, Madison. Casey, I'll move us back to our questions so you could see them.
That
Our
sounds
next
good.
our next two are pretty simple though.
So the next question is, what do you like about the plan? Feel free to unmute, to raise your hand, or to write it in the chat.
My favorite thing about this meeting is that I'm able to be here without the help of people, without the help of my friend of Jennifer. I wouldn't be here advocating for families and kids, especially including Jason, and especially kids including and other special ed and other special ed students, because I go to Valley High School. It's on Woodland Avenue. They do give you like free college classes you can take. Last in my senior year, I took child development, and that's a college class that goes from DMAC through Valley High School.
That's wonderful.
Thanks for sharing, Madison.
Thank you, Madison. Does anybody else want to share about
Yes.
what you like about the plan?
I'm encouraged that Iowa is asking what parents or families are wanting. And I've seen this progressive movement for the last year or year and a half or 2 years, because you've had those town hall meetings in Cedar Rapids and how you guys are rearranging the funding and you're letting everybody know what is going on, as opposed to, oh, I don't have services. Whereas you are talking to people, and even many of the people that aren't able to be here tonight are going to be able to watch this video. and or listen to it. And so it's so progressive that as Iowans, we are talking about what we can do. And it's empowering me because I've taken a little break from being an aggressive mom. But I think I'm starting to get back into finding a way to share my voice with people.
Great. Glad to hear that.
Thank you for sharing, Consuela. Does anybody else want to share what they like about the plan?
Do you want to move on to our second question or our fourth question, which is what you don't like about the plan?
Okay, sounds good.
And this is, if we could just phrase this is just about the state plan. So we know there's a lot of stuff that's going on out there that people don't like about their service and supports, but this particular question is just about what about our plan did you not like, if anything?
what 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 would anybody want to share? What could be improved about the plan that something that you didn't like about the plan? About the goal one or goal two or the objectives. Feel free to unmute or to type it in the chat or to raise your hand.
Hi. The one thing I didn't like about the planning part was that there was not enough. It didn't showcase how how people with disabilities can overcome the trauma in the school in their own in the state and still come out okay.
That might be something, Madison, that we can do with the storytelling part of our state plan, where we help people create their stories and share those types of things, because your story would be very important for other people to hear.
If I'm understanding correctly, Madison, were you referring to that you would like to see more focus on the trauma component, uh, addressing trauma that might come from certain barriers? Is that
Yes,
what I'm understanding?
especially because I've had tons of needles poked in me, and it's been so interesting getting to know more about people's health about the healthcare stuff. And I also want to say that trauma trauma doesn't come within in one form. It comes in multiple forms. You just have to find the right type of dis you just have to find the right what the tra forms of trauma the right form of trauma, whether it's accidents, whether it's family emergencies, and other forms of trauma like that. And that's what I'm really looking out for whenever I go to the hospital, whenever I go to hospitals or clinics. I'm really paying attention to how many people to what people say about their trauma, and I'm trying to let them know that they're not alone in this fight and that they are enough and that we are all in this together.
Thank you for sharing, Madison. From what I'm understanding from what Madison is saying is that there is medical trauma that comes along with disability. And if I understand correctly, Madison would like to see medical trauma addressed not only for the individual but their families, since there are some complications that come along with certain disabilities.
And that might be a good fit under our health goal objective that we have, Madison. So thanks for that.
I knew it because I was born at Mercy 1. And I understand they have to go very quickly through the traumas. And they have to address it on a day-to-day basis.
Yeah. Thank you so much for sharing. We will definitely write it down in the notes. And does anybody have any input on what they don't like about the plan, the state plan? Feel free to unmute or to write it in the chat or to raise your hand.
I'll go on to our next question, Casey, for you. I don't know if you have it in front of you, but while people are thinking about that.
Thank you, Brooke.
You bet.
So our next question is, who else should we partner with to help achieve the plan? Um, uh, uh, um, when it comes to partner with, we're referring to the organizations that are part of the council. Is that correct, Brooke?
No, it's actually, we're thinking of people outside of the council. So folks that we may
Okay.
not partner with today, if there's other
Okay.
agencies or entities that people could think about that they don't think we're partnering with.
Okay. Something that comes to mind is Systems Unlimited. Consuela mentioned Systems Unlimited.
And we do partner with them. They come
Okay.
every once in a while to our advocacy days that we have at the Capitol. But thank you,
Okay.
Casey, for bringing that up. But yeah.
Does anybody have any recommendations of other collaborators to collaborate to partner with? Feel free to unmute
All
or
I
to write
can
it in the
think
chat.
of is Child Servant Blank Children's Hospital. I also think that Mercy One, Wesley, and some of these other resources are important. Also to mention the child, not at least not child, the children, not like other children's hospitals, even city council. Like, I've known Greg Hudson since I was a senior in high school. He and I have been talking for a while, and I was thinking, he works with city council. He'll understand this stuff. And does he ever? And oh man, he really does.
He's with the West Des Moines City Council.
He's with the West Des Moines City Council.
Okay. Thanks for that, Madison.
Does anybody else have any suggestions of potential partners? For the next question, how can we develop better relationships with others in the community who may not know us? Feel free to share either in the chat or to unmute.
This one's always a tough one.
Yeah.
That's why it's always tough for the council too, because we know that there's agencies out there and organizations that may not know of our resources. And so we're always trying to reach those folks.
Um,
I think we can probably move on to the next one, Casey.
okay, sounds good.
Which is our next one's pretty easy too.
Madison was saying this, he can relate to this.
Yeah, yeah. Sorry, Casey, I lost my share button. There it went. But Casey, our last question is just what other suggestions do you have for the council?
Okay.
So that's our last one to kind of wrap things up. Any final suggestions people have?
Does anybody have any final suggestions for the DD Council? Feel free to unmute, raise your hand, or to write it in the chat.
I think they should also collaborate with Variety, the children's Variety Classic, the children's charity, for advocacy, because they have exceptional advocates too, and they have kids of their own. They have children with disabilities, and they work tirelessly to fight for children with disabilities. They also do reimbursement for equipment and stuff, and they also take they also do Blank Children's Hospital also does the Butterfly Fund, which is a program based on the children of today and the children of the future and future generations, and it's based on our children, and it has to be with Hammer and other medical places. Blank Children's Hospital does it. I wonder if Mercy One does it too. I'm gonna have to ask Heather, who's a nurse at Mercy One. She's a peds nurse, and I'm gonna have to ask her about that too the next time I see her.
Thanks, Madison.
Thank you, Madison.
Seamus, you're the only person that is left that hasn't made a comment yet. Is there anything about the state plan you'd like to make comment about, or any suggestions? Not to put you on the spot, but since we're such a small group today, just didn't want you to get off without not being able to get off the Zoom call today without being able to say anything.
And Seamus and Noreen, do you have any suggestions? If you feel comfortable sharing,
Or put in the chat.
feel free to add it in the chat also. Seamus?
Oh,
So
thanks.
he said it's very informative.
Well, let me share
Thank
the last slide here, which I don't know what happened to my PowerPoint. There we go. Okay, let's share the last slide here because this has our contact information, because
Okay.
just because if you get home, hopefully you are home, it's almost 7 o'clock. Hopefully you're doing this at home. But let's see here. Yes, so you can continue to share your feedback if you want to think about it a little bit more. I know, Madison, you said that you didn't really have a chance to look at the plan. and our goals. So there's still plenty of time for you guys to do that. So go ahead and send us, you can call us in with that. You can email us, you can take the survey, you can email me, any way you feel would be the most helpful to continue to give us comment about it. So if you didn't feel like you got to do it today, there's still plenty of time.
They said the DD Council email in the chat.
Thank you, Casey. That's great. So yeah, and we have 2 more of these listening sessions happening too, and you're more than welcome to join those as well too. Although you're going to hear the same goals. We're not changing the
I was
goals
also wondering, should I join, how can I join, the Capital chat too? How can I join that too? Because I was wondering if I would, because I've
always
missed a
welcome to
couple
join
of
that.
them.
And all of those are on our website. You can always follow the get the recording off our website. So our next one is April 17th, and I'm going to put that link, the register for that, Madison, in the chat. Because those are usually, always during lunchtime. So anybody can join. So feel free to do that. And then you can go to that same kind of website to see the past ones that we've done and get the slides. So if you aren't able to attend, you can always get the information. So go ahead and get signed up for our next one, which is next Friday.
Sounds good.
All right. Anything else, guys? Any other final comments you have, Casey?
Thank you everyone for attending today's listening session.
And Jeff, thank you for interpreting for us. All right. Thanks, everybody. Have a good night.
Thank you.
Try to stay dry.
Bye.